Oxfordshire. And if we can start sharing the slides, that would be great. So over to you, Barbara.
Okay, good afternoon and welcome. My apologies first, I've had a few technical issues, so I don't have the banner behind me. I've had to switch from one machine to another. But anyway, my name is Barbara Shaw and I'm Chair of Healthwatch Oxfordshire. Welcome to everyone and thank you for coming to hear about the activity of Healthwatch Oxfordshire during 2024-25. This has been a busy year listening to the voices of people in Oxfordshire about health and care in a context of change. I'd like to thank all those who gave us their views and to everyone who has supported us with our work, including community and voluntary groups and health and care providers, as well as our staff, trustees and volunteers. Working together is really important to help support and improve health and care services. Special thanks go to Don O'Neill, who was chair during 24-25. Don has stepped down after 7 years of supporting Healthwatch Oxfordshire. Thank you to Don for all your hard work at Healthwatch, and we wish you good luck in your future roles. Today you will hear from the Healthwatch team about some of the work we have been doing in the past year. Please do take a look at the annual report, which is available online on our website for a much more detailed view. We'll be printing copies, and also please speak to us if you would like a paper copy. There will be a chance to ask questions and comment at the end. Please put your questions in the chat or raise your hand and we will try and help, and we will try and answer as many as possible. Now I'll hand over to Veronica to start the session. Veronica.
Thank you. So for those of you who don't know, Healthwatch Oxfordshire is the trusted independent voice that sits outside the health and care system and brings the voice of people who use and experience services to the health and care system to help develop and build services. We really work hard to support the voice of the patient in all aspects, from policy making through to comments about health and care services. We have a statutory responsibility, and health and care services have to respond to Healthwatch recommendations based on what we've heard from patients under that statute. If you can move to the next slide. We work in all different ways. We're very creative and dynamic. We don't just do bog standard surveys, although that's part of our work. We're always developing the ways in which we reach people and really trying to reach all people, including those who don't normally have a say in the way health and care is developed or about their experience. We listen, we're out and about, we're on the streets, we're in workplaces, marketplaces, libraries. We build strong links with the community and voluntary sector, and we provide that bridge between communities and voices and the health and care system. We also have this statutory function, as I said. I sit on the Health and Wellbeing Board. We report to the Health Overview Scrutiny Committee, the Safeguarding Adults Board, and we also feed into committees in the wider commissioning landscape with health, the Buckinghamshire, Oxfordshire and Berkshire West Integrated Care Board. But what we do is make sure that the voices of people are at the forefront of the way we do that. Next slide. So it's not just about numbers, but these are some of the numbers of what our small team has achieved over the year. We have reached over 5,000 people listening to their experiences of health and social care. And as I said, that's not just by an online platform, it's actually being out and about and speaking to people and having trusted conversations. We have over 300 people coming to us for very advice and information about all the local health and care services and how to navigate that. Over 500 people have given reviews of their health and care services that they use via our online feedback centre and paper forms, and that enables them to comment directly on the care they receive. And then we distribute over nearly 6,000 we reach across all the sort of voluntary sector networks, but also individuals, with newsletters bringing people up to speed with both health and care information, what's going on, how to get involved, and valuable information about health and care services. Next slide. Again, in numbers, the highlights of our year. Someone has no sound, I've just seen. Anyway, the highlights of our year, we've published 38 reports. So those are written reports. We do them in easy read and accessible formats, but they are central to bringing people's voices to the health and care system. And as I said, going to committees, but also developing that dialogue. We're a small team. We have 6 members of staff. We're not all full-time. We've got a wonderful lot of volunteers and our voluntary trustees who help steer the work. We have a core contract for the Healthwatch function from Oxfordshire County Council, with additional funds from Buckinghamshire, Oxfordshire and Berkshire West to help us feed into that wider system and footprint. And then we also do generate a little bit of money through small projects where we're using our expertise in engagement and research to continue the Healthwatch function. So I'm going to hand over to our research lead, Catherine, who will talk a bit more detail about some of the work we've done.
Yes, hello. So as Veronica said, one of the ways that we work to hear from people is by carrying out more focused research projects to look at particular aspects of health and care services or particular parts of people's experiences, or to hear from particular groups of people. So some of the work that we did this year looked at what it's like supporting children with their oral health, particularly children with special educational needs or disabilities. And we also heard from parents and caregivers, particularly in Banbury, Neathrop and Ruscott, about what the challenges and strengths were there. We heard from people about their experiences of eye care services across Oxfordshire, and also their experiences of leaving hospital, which I'll talk a bit more about in a moment. One of our big aims is to make sure that we're hearing from all communities, and like Veronica says, particularly those who don't always have a say or don't always come forward with their views for various reasons. So as part of making sure that those voices really are heard, we did some specific targeted work this year, working with Community First Oxfordshire to hear from rural communities in North Oxfordshire about health inequalities that affect them. We did outreach on the street and in industrial estates across Oxfordshire to hear from working men, who are a group that particularly don't share their experiences often. And we worked with Public Health at Oxfordshire County Council to hear from people who live in Wood Farm and Town Firs, one of the priority deprived areas in Oxford, about what supports their health and well-being. And again, that was through a lot of street outreach and even door knocking to make sure we really heard from a diverse set of people and those who wouldn't normally have their voices heard. We also produce reports to make the most of the things that we hear through our other channels. So we write summaries of what we heard about GP practices, pharmacies, and also hospitals. With our reports, we write recommendations based on what people have told us, and then share those with decision makers who have a statutory duty to respond to what we've recommended. And then that's part of a process of making sure that people's experiences really inform and influence the development of local services. And we follow up at 6 months and 12 months to really make sure that that action is happening. One example of how we made a difference this year was through our project on hearing about people's experiences of leaving hospital and getting care and support afterwards. This was partly in light of the development of a new way of supporting people who go home from hospital, where adult social care and health providers were working together to get people home as soon as they're medically ready, with whatever care they need, and then have their care assessment once they're home. So we worked together with health and care services to make sure that we were really reaching people who are going home through this route, and also providing insight that would be most useful, and most sort of able to have impact. We use surveys and direct phone calls and outreach to hear from 206 patients and unpaid carers about their experiences. And we also heard from 87 health and care professionals about how this more joined up way of working between services was going. We heard that there's a lot that's going really well about this new system, and particularly people being very glad to be home rather than waiting in hospital for care to be arranged. But we also did hear about some gaps and inconsistencies in the support available to people, in the quality of the support they got, and communication, and how well people were involved in conversations about what was going to happen to them. So based on the recommendations we made, and since our report was published in November, we've been really pleased to see some impact happen already. Oxford University Hospitals produced a new patient leaflet about discharge and this new process to make things much clearer to patients and their unpaid carers. Oxfordshire County Council, in the process of launching new training for their social care providers in how all of this works and to ensure that consistency and quality of care. And they've also put out a specific feedback survey to hear from people who are getting social care support after being discharged from hospital, to make sure that patient voice continues to be a part of how the service is delivered and not just a one-off from our report. And also we've been really pleased to see that health providers are testing out and then building on more proactive ways of following up with people who've gone home from hospital, to make sure no one's sort of left wondering who's going to help them. So that was all really positive to see, and we'll continue to follow up to make sure that the other recommendations are acted on. I'm now going to hand back to Veronica to talk about another aspect of our research work.
Yes, so one of the ways we've worked over the last 8 years is to develop a community research approach, which puts communities at the heart of bringing their voice to the fore and also identifying topics that are important to them. And these are communities who might not normally feed into the system or be involved in bringing their voice. We've done a range of topics over the last 8 years, including focus with women on Black women's experience of maternity services, men's health, and on mental well-being. But this year we were lucky enough to support community researchers Hassan and Mujahid from Oxford Community Action, who wanted to explore the impact of the cost of living on people using emergency food services in OX4 area. This type of research is a long journey. It takes an asset-based community development approach, and you're working alongside communities through every step of the research journey to make sure that they are involved, that their skills are developed, that they learn this action research process, identifying what's important to their community, analysing what we hear, coming up with recommendations. But then critically, Healthwatch Oxfordshire helps those voices to link to the health and care system so that those voices can be heard. The focus on action in this type of research is a partnership with these grassroots communities. So to take the example of this piece of research, working with the OX4 food crew, who provide over 1,000 emergency food support to communities in East Oxford. They heard a lot about the impact of the cost of living and food poverty. But what we did was support them to run an event themselves, which brought decision makers and the groups together to talk about how this could be better supported. They also moved on to bring weekly advice sessions into the food services for people on the cost of living, housing benefit, immigration advice, and that sort of thing. They've also piloted a social supermarket, and they've set up a community allotment. So their energy is ongoing, but Healthwatch Oxfordshire is alongside this type of work, and it feeds into the wider system. For instance, a few weeks ago, with these groups, we supported bringing over 100 people with others in the voluntary sector to feed into Oxford Health Oxfordshire's health inequalities work and the so-called Marmot focus in Oxfordshire, bringing those voices to the table. So I'm going to hand on to my colleague Amir Alagab for the next section.
Thank you and hello everybody. I'm Amir, leading the enter and view visit to the health services. As a health watch, we have the power under the Health and Social Care Act 2012 to make enter and view visit to publicly funded local health and social care services, such as hospitals that belong to Oxford University Hospital or Oxford Health, and residential homes, like all the care homes around Oxfordshire, GP practices and dental surgeries, as well as the pharmacies in the hospital or community pharmacies. Enter and view should not be described as an inspection. It is a different program. And the main aim for the visit is to identify what works well and what could be improved to make people's experiences better. We visit to observe how the service operates and provide its service, to collect views from patients and staff on the service, to identify best practice and highlight any area of concern, and finally to report what we observe and hear about the quality of services. Enter and view are carried out by a trained staff and volunteers who observe how the service operates on the day and talk to patients and staff about their experiences. Based on what we are seeing and hearing on the day, we highlight areas of good practice and recommend improvement as well. Our recommendations range from ensuring patients know how to give feedback to highlight practical work to be carried out as well. We report finally to the providers, commissioner, Care Quality Commission, Public and Healthwatch England. What we have done during this year, we have done 11 enter and view visits, and we published 13 reports in our website. That's including some we made from the previous year. All the reports are in our website. If someone wants to check, you can also go ahead and look for that. Next slide, please. Based on what we are doing, we randomly select a case study as an example for a difference what we are making and what we heard from the provider. We made an enter and view visit last year during October 2024 to Boots Pharmacy in Oxford City Centre. And on the day, we spoke to 20 members of the public and pharmacy staff. We observed all the service about the environment, and we observed all the service, how the staff are working and how the patients also are engaging with the staff. We made some recommendations. Some of the recommendations already immediately Boots Pharmacy have taken immediate response, and they're taking care of to continue on doing the actions for the rest of our recommendation. What we recommend for them to make signs about the hearing loops more prominent, because some people may need to use it while coming to the pharmacy. Ensure there is an information for customer about how to give feedback, because most of the people, when we engage with them on the day, they don't know how to give feedback to the pharmacy, and also to make complaint and to inform them about other services available in the pharmacy. We heard from some patients also, or customer who came directly on the day, that directly they came from the GP practices to collect their medications, which is in most of the time it could not be ready at the moment when they are arriving there because of the limit time for collecting and preparing the prescription. We wrote a recommendation to work with the local GP surgeries to ensure patients are given accurate timing for when their prescription will be ready, because most of the patients on the day, they mentioned that they're coming and waiting for some time in the pharmacy, and sometimes they're not getting it ready. So that's all our recommendation, and most of the recommendation the pharmacy has taken action on that. And thank you for listening. I'm handing over to my colleague Vicky.
Hi, I'm Vicky. I'm the communications lead, and it's my role to help raise awareness of who we are and what we do so that more people know how to access our help and support and how to share their views and feedback with us. We work really hard to communicate our work as widely as we can so we can reach as many people as possible, especially those that we don't usually hear from. Our website is one of our main communication tools. That's where we showcase all our news, events, projects and reports. There's lots of really useful information on our website as well about local services and organisations. And we've added a new section this year to help highlight our impact and some of the changes and improvements that have happened as a result of our work. Our website is home to our feedback centre, and that's where people can leave a short anonymous review of using a local health or care service. And then we share those reviews with providers so they can see what's working and where improvements are needed. We also send out a newsletter every fortnight, and we're very active on social media, posting regular updates on Facebook, X, Instagram, LinkedIn, and more recently on Blue Sky too. We are, however, very aware that not everyone is online, so we also produce posters and flyers and leaflets about our work. We also share our news with partner organisations, the local media, and local community and parish newsletters. Alongside promoting our work, we also share other helpful health and care news and information, particularly things that might help people to access local services. So, for example, this year we redesigned and sent out 2,500 copies of our Access to Health card, which explains people's rights to accessing treatment and registering with a GP practice. We also worked with Oxford Community Champions to create a really brilliant short film about the language support that's available at GPs. And we found out a couple of weeks ago that this film has won an award. So do check that out if you get a chance. We'll put a link in the chat to that. Sometimes our work covers gaps in information and support that we can help with. So as an example of this, during our work asking about children's oral health, we heard that parents and carers of children with a special educational need or disability really struggle to find helpful information tailored to their needs. So we worked with Community Dental Services to create a new leaflet on how to help children with SEND look after their teeth. Accessibility is also important to us. We have a Recite Me tool on our website. We offer translated materials wherever possible, and we produce easy read versions of all of our research reports, which are all available on our website if you'd like to have a look. I'm now going to hand over to Carol, who's going to talk about our information and advice service.
Hello, everyone. I'm Carol, so I lead on information and advice. You can see from our slide that people can contact us by telephone, by email. Last year, 344 people came to us for information and advice, and the top issues around access to GPs and NHS dentistry. I think I would say more recently, access to NHS dentistry has improved. However, access to GP services, getting appointments, etc., still seems to be a hot topic for those people who do contact us. I think I can give you some real life examples. I think at Healthwatch, you know, we are an independent organisation, and it's really quite a privilege that people trust us with their information when they share really personal data with us, and we have to be honoured with that because, you know, we're trusted, and I think it's quite amazing that we can help people. I think some of our people who contact us very straightforward, you know, want to raise a concern about GP practice, been in touch with the practice, practice hasn't responded to their complaint. So it's very straightforward to signpost on to the Buckinghamshire, Oxfordshire, Berkshire West Integrated Care Board, BUB-ICB for short, to their PALS service to enable them to get support with that complaint. But I think some of the requests we get are really rather more difficult, more challenging, and we don't know the answer to everything. Sometimes we have to go away and find out, but, you know, it's something that we try our best to do, and even if we can't find out information, we will go back to people when we say we will. So one of the things I was contacted with, somebody wanted some information about IVF, wanted to know what the process was, did they have a choice of where they were referred to in Oxfordshire? Didn't know the answer to that, so found some information out, managed to send them the Buckinghamshire, Oxfordshire, Berkshire West Integrated Care Board policy on IVF, sent them a patient leaflet. Couldn't find out about choice, so I spoke to NHS England. And NHS England couldn't answer that, but they gave me the email address for the Choices team. So I was able to go back to that person with some information that hopefully helped them to find out their pathway to getting the IVF referral where they wanted to. I think one of the other examples, very briefly, is somebody who contacted us who was autistic. Known to mental health services, and was concerned about, they were coming off a medication and were concerned about how that medication, that change would impact on their mental health, and they were becoming a bit anxious and stressed. And although they did have an email address to get some support, they weren't really very computer literate. So what we did is we signposted them to the Keystone mental health hubs. We signposted them to Safe Haven, so where they get that physical support. And also we gave them a telephone number for an organisation called Aspens, which is a peer support network where they could access some really specialist autism advice and information. And it was just nice that when people do come back and say, thank you so much, I wouldn't have known where to find this. And, you know, thank you for that signposting. So thank you for listening. And I'm now going to pass on to my colleague Jazz, who leads on our engagement and outreach.
Hi everybody, I'm Jazz Cundy, engagement lead. Everything that Healthwatch Oxfordshire does brings the voice and influence of local people to the development and delivery of our local services. We continue to develop relationships with our local authorities, stakeholders across the county, and those, especially those that live in our 10 deprived wards. I love going out and developing relationships with our communities. This really feeds my soul, knowing the voices of the people are going to be in our reports. So what did we do? We go to community centres where there's events, libraries and larders. And when we're at libraries and larders, we do our feedback forms where people can report back of their experiences of what it's like using their services and anything else that's happening in the health and social care. We go to community groups, events and meetings. We went to Banbury Mosque, where we spoke to people who were going to Friday prayers, and after Friday prayers about their experiences, looking at men's health, which was really good, and people sort of opened up of what their experiences. We go to play days, and we went to 7 play days. It's lovely going to play days. People talk to us whilst they're having an ice cream. Everybody's really happy. Festival and fairs, and going to town centres, talking to people on the street. Over a period from July to September 24, we spoke to 744 people. We make regular visits to talk to people at hospitals run by Oxford University Hospital. What we hear there, we share with our commissioners, our providers. This is really valuable information where what is working and what needs to be improved. Next slide. So we ran 7 webinars on a range of topics attended by 223 people. These webinar topics range from GP surgery, it's all about teamwork, supporting mental health, and the 10-year plan. So in the chat, you will see all the webinars that we've done. If anybody here would like to come to a future webinar, let us know. Our webinars highlight the work that Oxford services and engagement and awareness of what's happening around. So it sort of gives information and a great opportunity to people to come together. I attended 15 PPG meetings, which was really good. Highlighted about the NHS app, of what's happening within the health and social care, develop relationships with our PPGs. In January 25, we attended and supported the Change NHS workshop, which was developed in collaboration with 3 participation groups. That was Millstream, Goring and Woodcote, and Wallingford Medical Centre. This was a great opportunity for the 3 PPGs to come together and give their views about the NHS, the Change NHS workshop, and that was fed into the strategy. So thank you everybody there. And also we supported, we did a great work on our working with PPGs about a PPG film, which we will show in a moment. I'd just like to say a big thank you to Hadina Health, White Horse Practice, Church Street, and Oxford Community Champions as well. Thank you. We're just going to show the film now.
We wanted to find out of what was happening across Oxfordshire with PPGs. We spoke to community champions, practices that organise community events, how PPGs have worked quite closely with practice managers to ensure that the patient voice is at the forefront of every practice. So our champions themselves are from a diverse community who comes together and talk to their own communities to understand what the barriers are in accessing health and well-being services. So we gather these insights and then look at solutions. So working with, for example, the Bob ICB or GP surgeries to actually address those issues. The migrant communities were saying they don't know that they can ask for an interpreter when they go for their appointments. So we have created a video to raise awareness about translation services that is available in GP surgeries. We have worked with the Luther Street Medical Practice to help them to engage with the homeless community. So the champions have created a postcard of the timetables of all the services within Luther Street Medical Practice and then shared it with the homeless community. I think one of the main outcomes is the empowerment side of things. They feel that they're part of the community and their voices are also heard.
I knew I needed something to fill my time, and it's a lovely way to give back to the community. We get involved as much as we can in helping out the practice. So we're all practice champions and we have various groups that are set up. The first one was the digital cafe, and then we've got a walking group, we've got a men's group, there's a menopause group, and I think what is really brilliant about the practice is that they're open to any groups being set up. If there's a need for it, a group will be set up for it.
So we hold digital cafes, which really is like a cafe, so it includes coffee and cake. Anyone can come along who has any digital challenge. We get lots of people obviously who want to get onto the NHS app, but it could be anything, even how to get onto WhatsApp, for example.
It's been very fulfilling, especially to see people who have come in really irked, going out with a sense of relief that they've actually understand their app.
I'm not that technically able, so I was a bit unsure and needed a bit of support. For an appointment, you don't have to phone at a certain time. You can use it at any point when you've got a moment, so it does make your life a lot easier.
I would encourage all general practices to get involved in running a pilot like this. It helps them with engagement from patients, but it also helps them in being able to manage that front door. Now they have a proper triage system set up. They receive the messages via Engage Consult and the NHS app, and they are able to then allocate appointments that they have a better view as to what they really need. We have lots of positive feedback from the patients, and for us, it makes us feel good too.
Coffee, books and conversation. So this is a reading group, and we welcome anyone who loves to read. They might have some health problems that they'd like to talk about.
I find it very rewarding to help others at the White Horse Medical Practice because they were so wonderful when they cared for my late husband. For me personally, it's a way of saying thank you.
There's an underlying reluctance for men to come forward and seek help. So it's another way of finding persistence, assurance outside of the surgery. People are not judged, questioned. They just turn up and chat, and we talk about almost everything. The initial idea of having champions was to take pressure off the GP surgeries by forming groups where people can self-support. Yeah, I think that any other patient group and GP practice should set something like this up. I just love helping people, and it's just great to put something back into the community.
It's really important to hear from the patient's side of their care and not just what we think that we should be providing. We worked quite closely together to make improvements, so we've recently worked with them to create our new website and also improve some of the ways that we work with inside the practice.
So the outcomes of the patient group are we devise a you said, we did, so that is evidence to our patient group of the actions of the feedback we've received as a practice and what we've come up with to try and improve our services for our patients.
So over the last few years we've looked at lots of different ways of increasing the patient group. We have a Facebook group for the patient group. We also have a Facebook group for the practice. We've found that we wanted to go to people rather than to come to us. So we're doing an event at the library for families, but also to promote the patient group there as well. Recently joined the Health Walk to see if I can get some input from that direction as well. Because ultimately what we want to do is improve the services with the practice and in collaboration.
There are two GP practices in this building. One is Church Street, which I belong to. The other one is Newbury Street. We try to run things as close as possible with the two practices because that way we're all singing from the same hymn sheet. We have a regular newsletter that comes out every quarter. People can download the newsletter using the QR code. We run a Health and Wellbeing Day every 2 years. We invite over 100 organisations. They let people know what's available that will help their mental and physical well-being. But we do try to make sure that everybody is covered and everybody knows where to get help when they need it.
Healthwatch Oxfordshire ensure that they are supporting patient participation groups. This is done via our website and also our news briefing. We offer the opportunity for PPGs to attend webinars. Last year we did a survey on the challenges that PPGs were facing. We're always here to listen to the patients and see how improvements can be made.
I hope that you'll all join with me to thank the team for such a wonderful range of excellent work that they've carried out over the last year. And we can see from the presentations how really important and impactful this work is. Before we open up for questions, I'll give a brief overview of our year ahead. I'm sure you've all heard the news on Saturday about the future of Healthwatch England and local Healthwatch. This is a huge period of change in health and care services as work continues towards the three shifts: acute to prevention, analogue to digital, and hospital to community. We are seeing the move towards neighbourhood health as well as the expansion of the footprint of the Bob ICB. We're awaiting the publication of the NHS 10-year plan to see the full picture, which will clarify the future of Healthwatch and how patient voice will be heard within the new structures. We'll be working with Oxfordshire County Council and the ICB to understand what this means for Healthwatch Oxfordshire. We thank our brilliant team for their skills and continued dedication and the great commitment of their work for Healthwatch Oxfordshire. We will be continuing to be there, listening to people in Oxfordshire and making sure people's voices are at the heart of health and care. We will ensure that patient voice is embedded into the new structure. Looking forward to this year, we continue to be very busy, working on our priorities which are set out based on what we've heard from the public and in response to the changing health and care landscape. Bringing the voice of people who use services is central to the success of creating a health and care service that meets the challenges of the future. This year, our work will continue to focus on 3 main areas. The first is hearing people's views. Our programs include quite an interesting timing because we'll be listening to patients' experiences of using the NHS app. And a link to our survey is available in the chat. We'll also be listening to people's experiences on using digital support for the provision of social care. Our second focus is on our community research, and we'll be looking at neighbourhood health and health inequalities as we continue to hear the insights and experiences of seldom heard groups. And finally, it will be business as usual with our enter and view visits, providing advice and information, supporting patient participation groups, and providing webinars on a variety of topical issues. So thank you for listening to our presentation today. I'll now open up for questions if anybody would like to ask any questions of the team. Laura, would you like to start?
Yeah, so I'm not going to come in with a question, but I am just going to say that thank you so much for a really fantastic report that actually I think only shows a tiny slice of what you do, because actually you also do a huge amount of networking, lots of organisations together and providing a bridge from big statutory institutions through to community and voluntary groups, but down to community. And I suppose, you know, my thoughts are that without a well-functioning Healthwatch that we're really lucky to have in Oxfordshire, I'm not sure how we would have that effective voice of the actual resident that can feed through that network. And so I think that's going to be at the forefront of my mind as we have these kind of system-wide discussions about the future. But just thank you for everything that you do and how effectively you do it, because I think I've said this in some other forums before, but I think sometimes we don't appreciate how lucky we are to have such an effective Healthwatch in Oxfordshire. 38 reports. It's astonishing with the size of the team that you've got, and the reports are really in depth, but also really easy and accessible to understand, and they work for a whole range of audiences. So yeah, thank you for everything.
Well, thank you for that. I mean, one of the reasons why I particularly wanted to get involved in Healthwatch was because, you know, for such a small team, they really sort of work well above their capacity, and, you know, such a marvelous range of things that they're doing. And it's just wonderful to sort of see today, you know, a snapshot of the work that the team has been undertaking over the last year. And actually to sort of, you know, tell everybody that we will be continuing to do that until we hear, you know, in more detail what the future is going to be. Jane.
Yeah, really want to echo everything that Laura has said, and you know, just a really big thank you. Obviously, you know, we have Healthwatch at every meeting of the Health Scrutiny. Healthwatch is at Bob Health Scrutiny as well. That's just one part of what you do, and it's that integration across sort of the whole of the system. And so I echo what Laura's saying, is I'm not sure what the plans would be for anything that would be other than what you're already doing, really. So I think we're all interested in seeing, but I think the important message, I think from all from myself really as Chair of Health Scrutiny is we're very much alongside you.
Thank you, Jane. Whoops, sorry about that. It's my iPad falling over. Veronica, do you want to sort of say anything before we move on to Olivia?
No, I just want to say, thanks for your comments. It's really important for our team, particularly at this time, to hear some of the feedback there. But as Barbara says, we're here, we're still listening, we're still working. We've got a really good programme of work this year. And we're really passionate about making sure that in the new landscape, the patient voice is embedded in the way services develop, and the new neighbourhoods and the new landscape, the work towards neighbourhood health. It's critical that communities who receive and experience health services are at the heart of that new development. And those three really important shifts, especially the shift to prevention, which will tackle some of the driving forces of acute access to hospitals that we see. So thank you.
Thank you, Veronica. Olivia.
Yeah, thank you, Barbara. I just want to echo and support the comments from Laura and Jane. And really, Veronica, you sort of slightly stolen my question. It was going to be about, given we've got a valuable amount of Healthwatch's time left, what are your thoughts? I mean, to me, it seems there's a considerable challenge for local residents about understanding the changes that are going to be happening through this year and a bit, and the role Healthwatch can play in that. Thank you.
Thank you. Veronica.
Yes, I'll answer that. I mean, absolutely, Olivia, the landscape is confusing for all of us, I think, in the health system, let alone people who are receiving services. And I think it's a period of, some anxiety for patients, as well as they don't really understand. So communication is really, really important, and that relationship. And we're continuing with our webinars. For example, in September, I think it's the 11th, we're going to be running a webinar on the NHS 10-year plan, bringing in the Integrated Care Board and others to explain exactly what that means for communities. We'll continue to, do our engagement and advice and information, and really make sure we push for that proper communication about these changes, and the impact it will have on people.
Thank you, Veronica. And Sam.
Yeah, my question was more along the lines of Olivia, but I think I need to say a big thank you for the work Healthwatch and the team have done in this space. I think if you think about, since the launch of the DPH report on inequality, the work on community profiles, the work on getting insight of communities, as well as other projects like in NHS Health Check, the work you have done, it has been absolutely critical to make sure that we don't lead in a top-down way. We actually do things in a bottom-up way, and we take our communities with us. And that is more important now than ever before, as we become a Marmot County and drive home and start to address things that we haven't touched on, things like rural inequality, for an example. So I think the timing is really critical. I guess my second point was around, we don't know what the new landscape would be. And we also don't know how the public will make of the new landscape. It's going to be always really complicated. So I think it's really important, and it's imperative on all of us to try our best to maintain the good work that has already happened and build on that, whichever shape or form the future takes. And I think how we protect the good work in that space is really highly critical. But a massive thank you, because I genuinely think some of the community insight work, the asset work, the bottom-up co-production stuff, understanding the community and taking the communities with us, whether we're talking about Marmot, inequality, NHS Health Check, whether we're talking about healthy food environment, all this stuff, it couldn't have happened without the insight and the input of Healthwatch. So a big thank you from me personally on that. But I think there's also a piece of work here around how do we actually protect the good stuff and build on it, whichever shape the new landscape takes. Or
Thank you, Ansaf. Veronica, would you like to respond?
Yeah, thanks, Ansaf. I mean, I think the role of Healthwatch is always a tricky one, isn't it? Because we sit outside the system, we can be a critical friend and we hold to account. But I think the way Healthwatch Oxfordshire has worked is to really try and bring and develop relationships and dialogue. And a lot of that's behind the scenes and it's invisible. It's quite hard to see the impact of that sometimes. But, you know, we do bring those voices into a range of different forums, and it's nice to hear that, you know, some of the things we've done, like you said, men's NHS health checks, you know, really does go into feeding into some of the ways and approaches that you use, but we're absolutely committed to supporting bringing those voices into, you know, the continued work.
thank you.
Thank you. Any more questions? Anyone else like to raise their hand? Tracy.
Hi, everybody. Just for honesty's sake, I'm a trustee with Healthwatch, and I'm the longest serving trustee that Healthwatch has had. And I've got to say that I'm never more proud than I am at annual report time, because working with this team is absolutely inspirational. They are small, compact, perfectly formed, and punch well above their weight. And it's been fantastic to hear and read the comments from everybody at the meeting today. So really, it's just my chance to say to the team, you're complete stars, well done again, and I'm just going to continue working with you until I can't. So thank you very much and all the very best to them. And I'm going to be cheeky, I'm going to say a quick hello to some of my old colleagues. Hi to Robert and Matthew and Sarah. So bye.
Thank you, Tracy. Carol.
Hello, I'm having a few problems with my camera.
Don't worry.
I want to echo the effusive thanks that I've heard from so many colleagues on this call. As the Commissioner of Healthwatch for the County Council, you are so important to Oxfordshire, and I think you've heard that, and this annual report is, as I said, it just scratches the surface of what you do. I hear about it on a quarterly basis and in between. As we look to the future, we are standing side by side with you. We will work with you, and we're extending that support. So I know it must be a really challenging time for everybody involved. So I just wanted to reach out and echo everything that's been said on the call. Thank you.
Thank you very much, Carol. I mean, yes, and it is a very difficult time, you know, so for the organisation, but you know, what's important is that we carry on doing the good work and that we make sure that our community research elements and listening to the patient and public voice is embedded in whatever it will be that will, you know, sort of the new system, the new way in the future. We're all a bit blind at the moment. All we've had is just the first sort of stark announcement, and we're waiting for the publication of the NHS 10-year plan and further information. So, you know, it really is our thought to have meetings and work in partnership with our system partners, you know, to ensure that the future of the work that we've been doing is carried on in some other way. But for the following year, it's business as usual. So, and, you know, please do get in touch with Veronica, and, you know, we want to sort of get around the table and talk to everyone as much as we can when we get some further information in about what the future is going to hold. Does anyone else want to ask any questions?
Perhaps I can just add a comment, Barbara.
Yes, of course, Veronica.
I think in Oxfordshire there is real commitment to making sure we work to reach and work, you know, support those who are not so engaged and heard and face health inequalities, and that's across the system. And you know, it's a recognition that everybody is going through change. We're all part of this, and we're all very uncertain about the future landscape. So, you know, but there's still that really strong commitment in the system, I think.
Okay, thank you. Well, thank you again to the team for a wonderful presentation on the annual report. I just, just congratulations to you all for all the fantastic work that you've been doing, and keep up the good work for the oncoming year. And thank you everybody who could join us today. Thank you for listening, and enjoy the sunny weather. Okay, goodbye. Bye.